If you are an anatomy educator that is involved in tableside teaching, and you notice this very familiar problem, and that is what I call missed learning opportunities. Let me explain. Now, missed learning opportunities are the doubts that students tend to raise as the dissection progresses. And the answer to these doubts are quite a challenge for us educators because they require demonstrating or appreciating structures that are spread across different regions and multiple systems in the body. So, to address these doubts goes beyond the scope of the dissection region, but using 3D anatomy atlases like Complete Anatomy may help you convert these missed learning opportunities into learning gains for your students. Hi, I'm Dr. Darren, a clinical anatomist, and I like using 3D anatomy models to teach during my tableside teachings. So in this video, I'm going to share how I like to use a 3D anatomy atlas like Complete Anatomy in my tableside teaching. I'm going to share some of my tips, my thoughts and processes that I have accumulated over the years as I've been using this atlas in my tableside teaching. So let's begin. So I'd like to start off with a story, the first time when I used the 3D anatomy atlas and found how it impacted my students in a positive way. So I was involved in the dissection of the peritoneal cavity, and most educators can relate that during this dissection, it becomes a very important point to raise awareness or bring in the clinical correlation of referred pain, because visceral pain tends to be referred to somatic regions. It ends up being a very important clinical symptom for young medical professionals to pick up. So let me show you what was the model that I prepared, and I will also explain what referred pain is all about. Now, a few considerations. Now, when I make these models tableside, I'm not focused on the details. Rather, I try to bring in the broad elements, and then I use tools like the annotation tools where I can go ahead and draw and show how the pathway completes itself. So let's get into it. So I'm going to launch the app on my tablet. When I take the session for my students and use my tablet device, it works well with a small group of students. However, when I find myself having extra students who want to join in, I either try to share my screen onto their devices, or if there is a monitor that's present tableside, I sometimes also share my screen to that. So once we come into the app, we have the hub over here. I'm going to go into the models part of the app, and that brings up the skeleton. Now, to demonstrate the structural basis for referred pain in the case of appendicitis, I would like to bring in the core structures that have a role to play. I'm going to first bring up the appendix. I'm next going to bring up the sympathetic trunk. Now, as I bring in these structures, I also use it as a point of discussion to involve my students, because it also allows me to quiz them on what could be the components that I'd need to load into the model. Okay, we have the sympathetic chain over there. We also need to bring up the spinal nerve and the spinal cord. So I'm going to do that quickly. Now, what most students at this point would know factually is that the T10 spinal nerve and the T10 dermatome is what is involved in referred pain of the appendicitis, because the pain of T10 is the pain of the appendix is referred to the paraumbilical region, which is supplied by the T10 spinal nerve. So let's bring that up. I'm going to type in T10. Right, so 10th thoracic nerve, right? Now let's see what happened. Now, yes, so I see the nerve over here. However, notice the proximal and distal branches are not present. So we can do that by using the info panel on the left. Now over here, I have two options, the origin path and branches, and I'm going to click on both, and notice what happens. When I press on origin path, we can see the roots, the anterior and posterior roots of that nerve have now come into view. And then I'm going to tap on branches, and you can see the blue structures over here that are highlighting that the branches of the 10th spinal nerve have come into the scene. I'm going to tap on search to exit the search menu. I'm going to zoom out, and that's good. I'm also going to remove the entire skeleton because, or maybe let's just remove the thoracic cage. So I'm going to tap on ribs, and on top there is the breadcrumb trail. I'm going to tap on thorax, and I'm going to press hide. Right, that's nice. Now the last structure is the spinal cord. So I'm going to bring that in. All right, so the spinal cord has come into the scene, but I'd like to go a little further and modify the model. I want to show the spinal segment T10 so that I can clear that concept for the students. So I'm just going to tap on these thoracic vertebrae, and I'm going to tap hide from the info panel. Okay, that's great. Okay, wonderful. Now at this point, we can get into the discussion, and I can talk about what is exactly going on in referred pain. So I first like to talk about why two pain impulses, right? That is the visceral pain impulse and the somatic pain impulse is getting confused in terms of perception. So the whole reason for that is because of convergence. Now what happens is in the posterior horn of the spinal cord. So I'm just going to hold this scene, move into the pen tool, and I'm going to just show that to my students that over there is the right and left posterior horn, and the somatic impulses and the visceral impulses, both of those converge at this point over here. And because they converge at that point, the next second order neurons, which are going to carry the impulses to the brain, do carry it, but the brain struggles in trying to discriminate the origin of those impulses, especially because the somatic representation in the brain is quite extensive. So this is the fundamental basis for referred pain. However, the students sometimes struggle with establishing the structural pathway for the impulses to reach this point. So let's go ahead and show that. Now I'm going to clear the 2D pen. I'm going to press done. I'm going to zoom out, and I'm going to now annotate and show my students how the visceral pain impulses reach the posterior horn of the spinal cord. Now, I haven't shown the visceral nerves over here. So like I said, this is a simple model, but I can use the annotation tool, and I can now tell my students that the pain impulses are going to start from the appendix. They're going to travel via the autonomic nerves as visceral afferents. They are going to then piggyback via the sympathetic trunk and reach the spinal level where it needs to synapse at. So I'm going to clear the 2D pen, I'm going to press done, and we are going to gently move upwards in the model. I'm going to rotate it slightly, and I'm going to reach the T10 spinal nerve. So here I'd like to tell my students that the impulses that travel via the sympathetic chain will reach the rami communicantes, and from there they will enter the spinal nerve, and from the spinal nerve they will reach this small swelling like structure that is present on the posterior root of the spinal nerve, which is called as the dorsal root ganglion, right? And from there, since this is a pseudo unipolar neuron, the axon will carry the impulse via the posterior root to the posterior horn. So I'm going to clear the 2D pen. I'm just going to move upwards, and again I'm going to emphasize that the impulses are climbing via the posterior root and entering the spinal level T10. Now this is where I like to further clarify what does it mean by saying the spinal segment T10. So a spinal segment is that extent of the spinal cord from where the rootlets, the anterior and the posterior rootlets of the spinal nerve emerge. So I'm going to just clear the 2D pen and instead I'm going to use the 3D pen. So the 3D pen is going to allow me to mark on the spinal cord. Sorry, I'll just put that in back. And I'm going to press done. Now I can show my students and tell them that this section over here, right? So maybe we can complete the marking so that it looks a little more presentable, and I can now tell them that this whole chunk of the spinal cord from where the anterior and the posterior rootlets are emerging is what is meant by a spinal segment. Now, what I've demonstrated so far is the pathway of the visceral impulses. What about the somatic impulses? Now, the somatic impulses are going to travel via the somatic nerve over here. That's the 10th intercostal nerve, which is then, is highlighted in pink over here, which is then going to carry the impulses to the spinal nerve, and from there again to the dorsal root ganglion. It's going to then ascend via the posterior rootlet of the spinal nerve, the posterior root and the rootlets, and then finally emerge and meet the partner at the posterior horn of the spinal cord. So in this way, I would have explained referred pain table side. My dissection would have been an exploration of the peritoneal cavity, but at this point, I would not have dissected the spinal cord or other regions. So it would have been quite difficult to create a structural basis for these physiological concepts. So this is where I feel using a 3D anatomy atlas table site, once the dissections are complete, enhances and converts these missed learning opportunities into powerful learning experiences for students. Now, in addition to this, I also use complete anatomy for prosections or pre-dissection planning because it becomes quite useful and easy to show the students what are the structures that they might expect during the dissection. I feel this is a very powerful feature as opposed to a 2D atlas because I can remove structures just like I would in the cadaver, and that, in my opinion, makes a very impactful experience for students. So that is how I use 3D anatomy atlases like complete anatomy in my tableside teachings. Now, if you also use 3D anatomy atlases to complement your dissection labs, do let me know in the comments below what are the techniques and tools that you use so that we can create some kind of a discussion, and maybe I'd like to learn from you as well. Thank you.